We looked at 2 or 3 immunological parameters, the first of which was cytokine responses, and we found that both in the Th1 cytokines and the Th2 cytokines, we saw augmentation in those cytokines in the patients that received the hormone therapy first, followed by the vaccine therapy second, not the other way around. So that was the first piece. The second thing we looked at was what's known as interferon gamma ELISpot, and this is a immunological test that serves as a surrogate for activated antigen-specific CD8 T cells, which are the cancer-killing T cells. And what we saw once again was that patients that had the increased CD8 T cell interferon gamma ELISpot responses were those patients that received the hormone therapy first, followed by the vaccine second, rather than vice versa. And the third thing we looked at was antibody production against the immunogenic antigen of Sipuleucel-T, which is a protein called PA2024, which is a fusion of PAP and GM-CSF. And what we saw was in both groups of patients, there was an increase in antibody production specific to that target antigen, but there were no differences between groups. So overall, at this time point, as far as the immunological data go, it appears that the optimal sequence does seem to be to use the androgen deprivation therapy first, followed afterwards by the Sipuleucel-T to get a maximum anti-tumor immune response in these patients.